Today on the Dr. Oz Show, all new. Got 30 pounds to lose? You may be a candidate for weight loss surgery.
This is a radical shift in thinking.
Once only for the morbidly obese. New rules say it could be for you.
Now more than ever, I think the lap band is a great option for patients.
The evidence is that they'll lose about 40 pounds.
Would you do it? Plus, the reality of life after weight loss surgery.
I'm flabbergasted. How can this fill you?
Next.
Today I'm bringing you blockbuster news about weight loss, and you will be shocked. I know I was. For the average height woman, if you're 30 pounds overweight, for the first time ever, the FDA says you could be eligible for lap band surgery. 30 pounds, imagine that. This is a radical shift in thinking that will help as many as 25 million more people lose the pounds and keep them off. Could you be one of them? You're about to find out if this is the go-ahead you've been waiting for, or is it the worst idea you have ever heard.
It used to be considered the treatment of last resort for the 72 million American adults fighting obesity. Last year, approximately 200,000 weight loss surgeries were performed in this country. Nearly half of them were gastric band surgery, a procedure in which an adjustable band is placed around the top of the stomach. In order to be eligible for the procedure, patients had to be morbidly obese, with a body mass index of 40 or more. But that's changing dramatically. The Food and Drug Administration has now broadened the approval to include people with a body mass index as low as 30, as long as they have at least one related health condition, such as diabetes or high blood pressure. We found two women who think they might meet the new criteria. They've each got 50 pounds to lose, and both have the same question. Is gastric banding surgery the safest, most effective way to lose weight?
My name is Vanessa, and I weigh 193 pounds. I've tried every diet you can possibly think of. Nothing seems to work. My weight really ballooned 2 years ago when I gave up smoking. It's gone up about 25 pounds. Physically, I feel like I'm deteriorating. Everything hurts. I am diabetic, and I have to do something about it before it gets worse. I do have a lot of questions about the lap band. I wonder if it's the right procedure for me. I'm just not sure. I'm very confused about it.
My name is Kathy, and I weigh 200 pounds. I have battled my weight most of my life. I would end up losing 10, 20 pounds and gaining it right back, and it just seems like this losing battle. I now have high blood pressure, so I have considered weight loss surgery. Some people look at me and say, she's not fat enough to have weight loss surgery, but every day I struggle with food, so why should I have to wait until I'm morbidly obese before I can do something about it?
I'm seriously considering the lap band surgery, but I want to know if it's the right thing for me.
So first, I want to show Kathy, Vanessa, and everybody at home how gastric banding works. I've got an animation to help do this. So let's go from the outside in. You're having the operation. There's the swallowing tube, the esophagus, and the stomach down here. You take a plastic band, you wrap it around the stomach, and you get it in place. Then you connect it to a little port. After the operation, you inject fluid in there. Watch what happens. If you go from the top, you'll see that there's balloon expands inside the pouch. That blocks off the ability of food to pass through, and only a little bit can trickle through into the main part of the stomach. That makes you feel full faster, which is fundamentally why gastric banding is interesting. Now, it's less invasive, if you noticed. Just that little band is placed around it. In fact, I'm going to show you exactly how it's done using a real stomach. Imagine this, again, if you have even 30 pounds extra on board, something that is now being considered according to the new FDA guidelines. So, I've got a stomach here, and you see the swallowing tube, the esophagus, is demonstrated above, and this is what the actual band looks like. So, surgeons will, with a scope usually, place this into your belly, then they'll wrap it around the stomach. Now, you notice the stomach has a pouch, so you want to block off the stomach by putting it towards the top portion of it. Then you literally pass the plastic tube through here, and you have just done the operation. Doesn't take very long. That's why it can be done minimally invasively. The other portion of the procedure is to put a little port like this, just beneath the skin, and you leave it there. You wake the patient up. Once the patient's awake, you put a needle through the skin into this little white area and inject a little bit of fluid. Depending on what you want to do, you can then blow up this pouch and constrict it more and more and more until, if you want, almost nothing gets through. And if it's too tight, you loosen it back up again. We all clear on this? Makes sense. And you can see how pretty simple it is. Now, if you only want to lose 30 pounds, the question is, does it make sense? Well, I brought together two experts, both at the top of their fields, with very different opinions on weight loss surgery for people who are not morbidly obese. I'm emphasizing, we're not talking about people who are 100 pounds overweight, where you can, notice that they're really having big issues. We're talking about people who are a little bit closer to what normalcy might seem like. Remind everybody what the new FDA guidelines are. Again, I'm going to emphasize, most folks don't know these yet, so I'll make it really clear. So this is what it used to be. The body mass index over 40, which meant for the average 5'4" woman, it's 233 pounds. Right? Or someone who was only 204 pounds, but they had one of the complications Dr. Roney just mentioned: high blood pressure, type 2 diabetes, heart disease, or sleep apnea. Right? That was what the criteria was. The new criteria, and watch this because it's dramatic, is now you could be 175 pounds. You're only probably 30 pounds overweight. So it's a dramatically different threshold, again, if you have one of these complications. Now, it's not a miracle cure, but I do want to point out that for a lot of folks, it may end up being the only cure for them because they're struggling, they can't get rid of that 30 to 50 pounds. That's why we're doing the show right now. I know we go through the diet, we go through the exercise, we go through these plans, but I know how difficult it is for all of you to lose the weight sometimes. When you start having those complications, I get concerned. So let me bring a surgeon into the discussion. Dr. Shawn Garber is a top bariatric surgeon. Come on up, please, sir. He's performed 2,000 lap band procedures. So, Dr. Garber, you've been patiently listening to the conversation. What do you have to say to someone who just can't get rid of those last 30 pounds and who thinks that maybe the lap band is a solution?
Well, I think now more than ever, I think the lap band is a great option for patients. We're doing them very minimally invasive. We do them through the belly button, virtually scarless with no scars right now. And more than ever, I think it's a great procedure for the patients. Like Dr. Roney said, I mean, the data from the FDA study from the new lower BMI showed 85% of patients were successful with the lap band, as opposed to regular diets, non-surgical diets, where there's over an 85% failure rate. So we're giving them something that is a great option. But it's also important to remember, like he said, bariatric surgery is a tool, it's not a cure, which I stress to all my patients all the time. They need to work with it to get the best results with nutrition and psychologists and exercise.
So walk me through some of the understandable concerns that folks ought to have about potential complications. What are the most common ones you see?
The most common things people are going to experience are, some people complain of heartburn or reflux, vomiting if they eat too much, don't chew the food or eat too fast, difficulty swallowing. Most of these problems, if the patients follow up regularly in the office, we can fix them just by adjusting the band. If the band is too tight, will cause heartburn or they'll cause vomiting. So just by adjusting the band, a lot of times you can alleviate a lot of these symptoms, or you can sometimes need medications. More serious things which we worry about long-term with the band is the band could erode through the stomach wall. In my experience, over 2,000 bands, I've never seen a band erode through a stomach wall. There's a 1% incidence of the band could slip on the stomach out of position, which is very easy to fix. Mentioned earlier was that it's very difficult to fix these things. To take a band out is a simple 15-minute operation. It's much simpler to take a band out than put it in. So the bottom line is most of these problems, if they happen, very easy to treat, and it's a minimally invasive procedure to fix.
How long does it take to put the band in? It's 15 minutes to get it out, which hopefully you don't have to do.
It takes about, in the proper hands, about 20, 30 minutes you can put a lap band in.
Right. Stop for a second. Ask Kathy and Vanessa what your thoughts are. You're both interested in lap band surgery. We've heard your stories. Everyone wants to go first.
I agree with the doctors that there's complications and risk as well as the benefits of the surgery, and I feel the benefits outweigh the risk.
So you think you're going to get it based on what you've heard so far?
Yes.
I feel the same way. I've been obese for over 6 years. I think it's time to do something a little different, and diabetes isn't fun. Bottom line.
No, it's not fun. That's fine. And you're speaking for a lot of folks who are watching right now. All right, the discussion continues. When we come back, we're going to talk to two women who are living with a lap band. What is the reality of life after weight loss surgery? And if you've ever thought about it, you're not going to want to miss this.
Coming up, together they've lost more than 200 pounds.
Before, I was definitely a bottomless pit.
See the change in their diet.
Is this your new life?
This is my new life.
You'll be surprised. Dr. Oz was.
I'm flabbergasted. How can this fill you?
The pros and cons.
If you do take 1 or 2 bites too many, hate to say it, but
Living with Lap Band.
If you had to do it again, would you do it again?
What they say could change how you think about it. Next.
We're talking about whether weight loss surgery is a safe and effective option if you are not obese. Joining me are Jackie and Robin, who are living with lap bands. They're going to offer their first-hand account of what life is like after you have had surgery. So Jackie had surgery 6 months ago, and she's already lost 50 pounds,
thank you.
which is a lot of weight.
Thank you.
So talk to me. You know, it's a big difference to who you are now. How has your relationship with food changed since you've had the surgery?
Yeah, before I was definitely a bottomless pit. I could eat mass amounts of food in one sitting. But now it's really just about portion control, small amounts, eating slowly. So now in the course of a day, I eat what I used to eat in just one sitting before.
All right, Robin had surgery almost 6 years ago, and she's lost, get this, 180 pounds. Again, a big difference between then and now. So what has it been like to maintain weight loss for 6 years without failing?
It's like an up and down battle, unfortunately. The lap band didn't, like a magic cure, take that all away from me. There are times that I go up maybe 15, 20 pounds, and then I'll work my way back down to where I want to be comfortably.
Now, if you had to just pick one thing that you were not prepared for, that the lap band forced you to cope with, what would it be?
The amount of effort it took to lose the weight and to maintain a healthy weight.
So we're going through an exercise today. We're trying to explain exactly what life is like if you have lap band surgery. So you've both agreed to share with us your diet plan. So we look every single day, typically what you eat. We'll go back and forth here. So who wants to go on? Take it. Now, Jackie, we can start with you.
Sure.
I want you to show us what you used to eat, and then I'd love to understand what you're eating today.
Absolutely. Lunch, typically pasta, chicken, fish, something to that effect. Dinner, I loved fast food, Mexican food, so I could definitely polish that off easy. A snack right here, a bag of chips, I could before eat that in one sitting, sad to say, but it's the truth.
Right. So you had your surgery, and is this your new life?
This is my new life right here. So typically this probably equates to, about half of a container, one of those little ones of yogurt, about 5 spoonfuls. For dinner or lunch, I can have about a cup of soup. If there is something in the soup, like chicken soup, it's a little bit harder to get down, so maybe not so much. A snack, a couple spoonfuls of pudding. But this satisfies me. I'm full when I eat this now instead of that.
I'm flabbergasted. I mean, how can this fill you? And this is a snack. The whole thing is one snack for me.
I told you I can eat in one day what I ate in one meal before. It's really the truth, but truly you do feel full after this.
If you ate twice that, if you ate, I don't know, this ziti here, right? What would happen to you?
You will, if you do take 1 or 2 bites too many, hate to say it, but you will vomit. It will come back up. So.
All right, Rob, let's go over what you had normally. This is your banding typical daily meal.
Absolutely. Lots of fast food, huge portions. If I did cook, again, I'd have restaurant-sized portions, so that was it.
Then you have your operation, and is this what you start eating day one?
No, day one, it looks more like Jackie's diet, which is more like soft foods and liquids. That's the beginning.
So you start this transition from this sort of soft foods to real food. Just chew it through slowly.
And I eat fruits and vegetables, yogurts.
Of all the things you've discussed, what is the hardest part of adjusting to the food you have to eat now?
Now I'm okay with it. I'm almost 6 years out, but in the beginning, social eating was hard because you don't pay attention, like you're talking and eating, and then you may have eaten a little too fast or a little too much, and it becomes uncomfortable. So the social aspect took a little time to get used to.
So I'm going to ask both of you a question. You both have made significant lifestyle changes since the surgery. If you had to do it again, would you do it again?
Absolutely.
100%. Absolutely.
I'm surprised, actually, but that's fantastic.
100%.
So, Kathy and Vanessa, let me come back to you. You're our jury today. You've got pretty much all the information that you'd normally get if you were going to spend a lot of time thinking about it. I'd just love to hear what your thoughts are.
That's how I eat every day. And I think that the surgery is something that I am seriously considering because I am addicted to food and eating that much. And I believe the surgery is an alternative for me to become healthy and not be morbidly obese before I do something about it.
And Vanessa, your thoughts? You talked earlier about your diabetes.
Yeah, being borderline diabetic and eating mass amounts of food only when I'm stressing or on the go, and so I'm considering it. I think it would be.
Vanessa, don't these food changes scare you? I mean, look at them. This is you know, there's lunch here. These, these spoons. There's lunch here. We're counting the number of noodles here. These are big changes. I'm pushing you because I know people are thinking this through. Listen, the reason I'm doing the show is because I know what the instinctive response is to folks when they hear about surgery for obesity. The first thing is, I'm a failure, it's a cop-out, it won't work. I know how it's covered in the press all the time, but I've been on the other side. I have seen these operations done. So I get both sides of the puzzle. I'm just trying to really get into the complete perspective on what decision-making issues there are.
I feel like it's the first time you're actually honest with yourself and realizing that, you know what, I haven't been able to do it on my own. And to me, that's a great strength to realize that your weakness is that you can't do it on your own. You need somebody to hold their hand out and help you get there. Start your journey, push you out of the nest and get you going. And I feel like that's what Lap Band did for me.
Scared about the foods, or you're okay with it?
I'm okay with it. I've done liquid, I've done acupressure, I've done everything. I'm tired. You know, my feet are killing me.
Have your last apple.
Thank you.
All right, let me speak about this for a second, because I want to give a little perspective. So I think the Lap Band device is a remarkably effective tool. It's minimally invasive compared to a lot of the other weight loss surgeries. We've talked about this. I'm going to emphasize it. It doesn't cure the emotional connection to food. You know, it might help you, give you the confidence, but if you don't deal with working on your relationship with food, nothing's going to change. That's important in your life. I don't care if you have a band or any other kind of procedure. Jackie, Robin, thank you so much for sharing your stories with us. To all my physician colleagues for being honorable and talking honestly about this problem. And to our 2 jury members today for helping make a decision for a lot of folks who are watching out there. We have lots more information on DrOz.com. We'll be right back.